You are being asked to do a hand examination. Don't forget to introduce yourself to the patient, look into his face, looking for any sign. Maybe you can pick by looking if there is any malar rash or tight or frontal hair loss or tightness of the skin, telangiectasias, big nose. These may help you to pick the diagnosis before you reach hand examination. Maybe also you may find hyalotrope rash, okay, which is part of dermatomyositis. So after that, you have to really expose the hand properly, including the elbow should be very clear there, okay, exposed properly. I would like to start with elbow examination. You are looking for any psoriatic rash. You are looking for any rheumatoid nodule in this area indicating rheumatoid arthritis. Then you inspect the skin, the muscle, the joint. For the skin, you'd say there is no psoriatic rash, no vasculitic rash, no scars. I don't see any guttural nodules. I don't see any dactylitis. I don't see any discoloration, bluish discoloration or Raynaud phenomena in the hands. The nail looks normal. I don't see any pitting, or I don't see any onycholysis, or which is separation of the nail, of the bed of the nail. I don't see any baronychia, which is inflammation of the angle of the nail also. By this you finish the skin. Then you would say the muscle bulk looks normal, symmetrical, unless there is wasting of the dorsum, the muscle of the dorsum of the hand bilaterally. Then you comment on the joint proximally to distally in this direction. You would comment about the wrist. You would say there is no wrist swelling, no MCB swelling or ulnar deviation. There is no boutonniere or swan neck deformity, no Z-shaped deformity. Okay, the ulnar deviation, you have to mention these if there is, and even if they are not there, you have to mention them. Then you move the hand to the other side and comment if there is any erythema. Could be palmar erythema, could be vasculitic rash, could be there is tenosynovitis, uterine contracture. All these should be mentioned. And after that, you may also comment on the thinner muscle if there is wasting of the thinner muscle. Then after that, you start to hand grip to see if there is any stiffness of the small joint of the hand. You would say there is no stiffness of the small joint of the hand, and we do prior sign to see if there is any irreversible fixed deformities, okay, especially in rheumatoid or scleroderma. Then you ask him also to do this, okay, to examine the wrist joint, whether there is limitation of extension or not, and ask him in the end to extend his hand to see if there is any fixed flexion deformity of the elbow. By this we finish inspection. Then we go to palpation. Ask the patient if there is any pain. While you do all that, he will inform you if there is pain or not. Then you start with the distal and proximal by pressing the joint and look to the patient's face. If there is a swelling, okay, you have to palpate for synovial for effusion by doing brushing from sides and above and below by 4 fingers to see if there is any fluctuation of fluid. Okay, if there is advanced deformities with ulnar deviation, you may check if there is subluxation by holding the hand, your left hand below his hand, and you hold the finger and pull it up and outside like that, outward like this. See if it is coming out from the position indicating subluxation. Okay. After we finish the small joint, we go to the MCBs. And just put your hand below his hand, and with your two thumbs examine each head of the metacarpophalangeal joint and look to his face, see if there is pain or not. Okay, you may also do it like that, just more stressing to the joint, and you may do hand grip to see if there is squeezing, test if there is any pain. And you go to the wrist for effusion, just press from above and below. So if there is any fluctuation of fluid, for tenderness, press the side, and you may do flexion and extension, see if there is pain with that or any limitation. Flexion and extension of the elbow, and press the lateral and medial epicondyle, and at the elbow triangle here, try to, between the half radius olecranon and lateral epicondyle, to see if there is any elbow fusion. Okay. By doing this to the right side and the left side, we finish the hand examination. Then we do carpal tunnel or median nerve testing. First, you inspect the thinner muscle, they are wasting or not. Then you ask the patient to do opposition, both hand, and ask him to resist your hand if you are going to open it. Do your right with his right and try to overcome that. Right one with right, left with left. Then you do tunnel test by hitting the median nerve in this position, like that, right and left, and ask him if there is any numbness happen during that hit. That is the tunnel test, and end that with a funnel test. Squeeze it, and you would say I would wait for 30 seconds to see if there is starting of numbness indicating positive of funnel test, and that indicates there is a carpal tunnel syndrome. By this, we finish examination of the hand and median nerve. Thank you very much.